Hello, everyone. Welcome to one more meeting that this will be our second one that we're streaming live on Facebook. So you can always go back and relive this moment if you're wanting to. Okay. Any guests here? I didn't get the guest sheet. Anyone? Raise your hand if you're a guest. And introduce yourself, please. Very good. Very good. Thank you, Candy, for bringing. Anyone else? Yes. Very special welcome to you. Holy cow. Any other guests? Any other guests? Well, it's good to see those that were brave enough to come out into the Corona. Have a Corona. I'm all for that. Any happy bucks? Let's go to that. Anyone? Nobody happy. All right. Well, hoping that next week we'll be able to start doing some raffles again. So if you could, everybody could bring something to raffle. That would be great. I think it's. Pardon? And somebody to run it. Yes. Volunteer for that. Anyway, I think we're done.
FYI, everybody, for anybody who is going to be attending Rotary meeting next week, we are going to go back to the buffet style for lunches. If there is anybody who has any particular issues with that, hopefully we can make arrangements to have a plate brought out to you. But for convenience, as well as portion sizes for Chuck and so forth, the conference center has asked whether we could go back to buffet, and we're going to go ahead and do that. So, in addition, as Chuck mentioned, we are streaming these meetings live now. I have not necessarily put that out in the email that goes out in the middle of the week, but for folks who aren't here because of the COVID issue, let's just spread the word to everybody that we are streaming these live, so they can take part in these meetings, at least watching it, and also goes to their attendance. If I could get Candy Waller to come up here and introduce our guest speaker for us.
Hi, I'm pleased to introduce Dr. Jane Glasgow. She is the Executive Director of the EVMS Minus 9 to 5 program, which is what she's going to tell you about. Before she directed that program, she did the Child Learning and Research Center at Old Dominion, and she was the program manager at the Child Development Lab. She has been an instructor for early childhood development at TCC. And here's the important part. She started her career as a kindergarten and first grade teacher, that is a brave person, in the Chesapeake public school system. She lives here in Chesapeake with her husband, Bob, and then lived here since 1988, and I've been trying to ping on her to join our club. And you've already met Catherine Jesse. She is with the local arm of this program, and the one in Chesapeake is called Are You Ready? Dr. Glasgow.
Thank you. Always appreciate the opportunity to talk about early childhood, my passion, but even more exciting today to be out and talking to real people in person where I can see your faces. So I'm a real people person, and this has been challenging. So thank you for the invitation and opportunity to talk about early childhood. So some of you may have heard of Minus 9 to 5. I hope a few of you have. We are a collective impact initiative. We are housed at Eastern Virginia Medical School. First thing, a lot of times when we say Minus 9 to 5, people say, huh? Are you talking about the time that a child is not in child care? No, we're not talking about that at all. Got to put your thinking cap on here. We're talking about the Minus 9 to age 5, the idea that getting children ready for school and ready for life starts prenatally. And so we focus on that prenatal to age 5, all of the pieces of the system, and I'm going to talk a little bit about that. And the other part of it is people say, oh, you're at EVMS, and then they see doctor, and they say, oh, you're a pediatrician. No, I am not a clinical person at all. My background is in early childhood education, and so I always say I'm the other kind of doctor. I can tell you a lot about child development, and I can tell you a lot about families and parenting and school and what children need, but I can't tell you about the medical side. So. And always still learning. We've been housed at EVMS for almost 2 years now, and was in a meeting yesterday with a bunch of doctors who kept using acronyms, and I finally had to send an individual chat to somebody and say, I have no idea what you're talking about. Can you give me some explanation there? So what is a collective impact initiative? That's a word that we hear, it's kind of a new buzzword that people say, oh, we're working on this from a collective impact perspective. But really simply what that means is we're a group where we convene people, we bring together folks where organizations, so partners and stakeholders, come together to make something different happen that they couldn't do by themselves. So we work on across the 5 cities, Chesapeake, Norfolk, Portsmouth, Virginia Beach, and Suffolk. And so we bring all of the folks that work in any part of early childhood from that -9 to age 5, bring them together to try to work a little differently. So Catherine Jesse from Chesapeake Are You Ready works with us a lot, representing some of the needs from Chesapeake, helping us to connect with important parts in Chesapeake. And Jerry Stewart is also involved in our initiative. Jerry's on our steering committee, formerly with Virginia Beach Economic Development, where interestingly enough, Virginia Beach's early childhood initiative lived within economic development. So they are just some examples of our partners and stakeholders that come together. So a couple things about collective impact. We work on a common agenda. So we have a little booklet similar to the annual report that's on the table, where we as an organization have come together with representation from all of the 5 cities, from cross-sector, from health to social services, human services, education, philanthropy, business, economics, have all come together to kind of create this vision and this idea about what we should be doing around early childhood. What are the goals for our early childhood system? I have a couple of common agendas if you're interested in seeing one. Unfortunately, our print stock on that was running low, and we're in the process of updating it, so I'm happy to share. I've probably got about 15 copies if anybody wants one, but I did share some other information with you. So through our collective impact, we use a common agenda, we have a set of shared measurements, we work on mutually reinforcing activities, meaning that all those organizations, we try to look at what's already happening and figure out ways to put all those puzzle pieces together that makes sense for children and families. We use a lot of continuous communication, as you see. We've got a lot of publications and information that we share that way. We have a very robust website that I'll share with you in a little bit. And then the other big piece about what we do is the backbone support. So often organizations will say, hey, we really want to work on this. We want to do this together, but one person, who has a full-time job maybe says, okay, I can take 10% of my time and work on this on the side. I am the backbone. I'm the executive director. I have an assistant director, and the two of us, we say we're a pretty mean party of 2. We are the backbone, and our whole job is to keep all parts of this initiative running. So as you see, as I talk a little bit more, our initiative is really very robust. We have a lot of moving pieces, a lot of moving parts, and so our whole job is to keep all of those pieces moving and rolling and things moving forward, which is a really great space to be in. Because often, again, we have the best intentions, and we say, we're going to work on this. I work for, organization A, and I'm going to contact organization B and C, and we're all going to come together. But organizationally, sometimes there's some challenges. There might be a little competition, the business model. There's lots of challenges, especially when you're working city by city. And so we have the pleasure of really kind of being that neutral convener to bring people together and say, well, how could we make this work a little differently? And can you, Catherine, talk to folks in Chesapeake, or who do we need to connect in Chesapeake, and use those relationships that she has. So we're really focused on systems building. In early childhood, again, from that -9 to 5, there's a lot of pieces that of the program, lots of things, lots of services that are offered, but they're often all very disparate. They're, everybody's kind of working in their own silo, their own cylinder of excellence. And so from a systems building perspective, we really want to take all of those dots and try to coordinate them and align them in a way that better serves all families, but also in a way that helps us utilize dollars better. We're always looking at federal funding, state funding, local funding, philanthropic funding, and certainly as a taxpayer, as a donor, I want to know that my dollars are being used in a way that works really smartly and that we're leveraging every opportunity. And so by doing all of these things, we're able to do that. So, down a little bit to the nitty-gritty, when we work together through this initiative, we can create a system where each family in Hampton Roads is equipped and supported to raise children who are healthy, thriving, and ready to learn. Our goal is to have babies be born healthy and ready to start life healthy. We have families that have the resources and supplies that they need. They are thriving, they have stable housing and food, and that they have what they need, which then goes a long way to getting children ready to learn. And, as a former kindergarten teacher, many of you, I know Catherine and Jerry have probably heard me say this many times, but as a kindergarten teacher in Chesapeake many, many moons ago, I realized that it mattered so much more what happened before those children ever got to my door than what I did with them in kindergarten. And so at that point, I actually I say I demoted myself in age level, but I really had a really pivotal change in my career that began to focus on those earlier years and looking at how we support families and what families need to get those children ready to learn and enter school. So this is just a little bit of the metrics that we look at, the things that we're trying to improve. This handout is on the table. I know it's kind of hard to read, but these are some of the metrics that we're looking at. Access to prenatal care, birth weight. Usually I can roll these off really quickly, but right now, because I have COVID brain, so it's a little difficult to even focus sometimes. Looking at home visiting programs that I think Candy mentioned that you all support CHIP of Southampton Roads, and as a home visiting program, that is such a beneficial program, but we know that across our region, that only 925 families across the whole 5-city region were served. I think that was 2 years ago was the data on that. We know that only 36 to 23% of our children are getting developmental screenings, that many of those children who enter school and are retained in kindergarten, it's a small percentage that are actually retained, but of those 400 children approximately that are retained in kindergarten, 75% of them come from low-income homes. And so looking at that data, we have moved forward to try to create some efficiencies in ways that we can work together. So as I said, we serve the 5 cities, Chesapeake, Norfolk, Portsmouth, Virginia Beach, and Suffolk. We are a pretty structured initiative. We have a steering committee of, usually it's about 22 people. We've had a couple of retirements and we're working on changing that up a little bit. So our steering committee, that's also listed on the back of our annual report in one of the handouts. But that is a group that kind of guides the strategic approach to what we do. And that's Dr. Nancy Welsh, the Director of Public Health, serves on our steering committee. Jerry, we have Dr. Sin Romero from the Brock Institute at EVMS, somebody from Hampton Roads Community Foundation, Thaler McCormick from 4 Kids. So really some of the big folks within the cities. We also have 2 deputy superintendents from 2 school divisions. Again, human services, philanthropy, faith-based, all come together to help move this initiative forward. We do our work through 6 work groups that meet. They had been meeting monthly. Right now we're just kind of have been in crisis mode and are pulling groups together a little differently, but generally we have 6 working groups that do the work of this initiative. Again, my role is as the coordinator and the convener. Although I know a lot about early childhood, I do not set the agenda. I do not say, hey, we need to do X, Y, and Z. We bring everybody together and say, what do we need to do? How are we going to do this? What makes the most sense? What does the data tell us? What's already going on in your community? And so those working groups, Healthy Homes, Healthy Children, one on thriving families, one on early learning and development, one on community connections, data and knowledge sharing, and policy and advocacy. And each of those work groups has between 3 and 5 action items that they are working on, and I'll talk a little bit about that. Throughout the initiative, through the steering committee and our working groups, we have about 160 stakeholders who are engaged in the initiative, and they represent over 100 organizations across Southampton Roads. So again, we have really a large group that comes together to make this work. We also have a leadership council that we are just getting launched. It was pre-COVID. We were supposed to meet, but those are some of the kind of senior leaders across the community that can help us connect with the right folks. So currently we have 18 action priorities underway, and that last sentence got deleted. We are happy to report that we just received grant funding from Virginia Early Childhood Foundation for $317,000 to serve 347 pre-K classrooms across the Southside region. Happy to report that Chesapeake Public Schools and Hampton Roads Community Action Partnership that does Head Start have been great committed players to this, and we're really looking forward to that. In total, over the last 4 years since Minus 9 to 5 started, we have been able to bring in $1 million in support for early childhood across Hampton Roads. That money doesn't all come to EVMS or Minus 9 to 5. Some of it I've written for it, or I've made the connection, and then we've sent it over to United Way or to another organization that makes sense to have it. But that's, $1 million commitment in early childhood is a pretty significant thing. So just wanted to give you a couple of examples of some of the things that we work on, some of the things that we've been changing and working together a little differently. So as I mentioned, Trish O'Brien, who leads CHIP of Southampton Roads, we have 12 different home visiting programs that serve our five Southside cities. It doesn't make a lot of sense. It's really challenging. Some of it's funded through Department of Social Services, some of it's funded through Department of Health, some of it's federal dollars, some of it's state dollars. But from the perspective of, if I am somebody who works with families and I know that this family could use these supports, how on earth do I figure out which of these 12 home visiting programs I should send them to? Which ones serve which city? CHIP, for example, serves Chesapeake, Portsmouth, Norfolk, and now Virginia Beach. But some others, Chesapeake Baby Care, which is from the Health Department, only serves Chesapeake, and they have a little different model than Nurse Family Partnership that only serves Suffolk, and Healthy Families that serves Norfolk, and another Healthy Families that serves Virginia Beach. So, really great example of how we try to help coordinate. We've been coordinating the Home Visiting Alliance, which is representation from all of those home visiting programs, to say how can we work together more effectively and making sure that we're meeting the goal of getting more families connected to home visiting services. And so, really looking at, we've been doing some aligned trainings. How can we offer and coordinate trainings? If you, home visiting program A, has money for a training, and you can invite programs B, C, and D into that training so that they don't have to go get their own funding, that makes a whole lot more sense, and we can better utilize those resources. So just an example of something that we're working on. We also have been working on a shared services pilot, something that has been really needed right now. We have funding from Virginia Early Childhood Foundation. We've been working with our partners in Chesapeake, again, all the 5 Southside cities, as well as Smart Beginnings Virginia Peninsula and Newport News and Hampton, to create some efficiencies and support for child care programs. I don't know how many of you have been involved with child care lately, but But pre-COVID, childcare was a challenge for many. It's expensive. The business models are often very thin as far as running a business and serving children. It's driven by what parents can afford to pay, or if they get subsidy, what the subsidy rates are, which is often less than the cost of care for those children. So we've been working on this pilot for a little over a year. Well, we've been funded a little over a year. We've been working on it for about 3 years. But the whole goal of this program is to bring child care programs together to create business efficiencies, back office support, some of the financial things, billing, accounts receivable, accounts payable, human resources, IT, bringing all of those things together so that the director of those centers is not so busy doing all of those tasks that then he or she can't get into the classroom and support teachers. And so we've had some great results. We have a program right here in Chesapeake that's been kind of our shining star. They were the first. They jumped right in and said, we are on board and let's get started. So Right Start Child Development Center, which serves families in South Norfolk. Catherine, do you know how many families? 50 children at Right Start. And they have worked with us, and we've seen some great results. We were sharing those yesterday with the advisory committee for this, as far as bringing, being able to collect tuition and fees and, streamline their business practices so that they're saving money and able to provide more support for quality and pedagogical leadership and quality building. So another thing that we worked on, this one we have pretty much handed off, but we worked very hard for about 2.5 years on a local resource database. There was one that was in existence, kind of on its own in a silo, wasn't necessarily really well used. We talked about how we could bring that resource database together with something already existing in the community in a way that made it more accessible to more people and more people knew about it. So I know that probably most of you are familiar with 4Kids, who's building a shelter in South Norfolk. And so we worked with Taylor McCormick at the Housing Crisis Hotline and actually took a component of that Housing Crisis Hotline of the software. There was a little component sitting over here called Community Point that it had already been paid for, but it wasn't being used. And so we worked for 2.5 years with the Kiwanis Children's Council and 4Kids and their board and their Housing Crisis Hotline to figure out a way to merge all of that information. We've learned that when people call the Housing Crisis Hotline, that only 91% of them, over 91% of them did not just need housing, but they needed other resources. And the hotline didn't necessarily have access to the information on those resources. And so by combining those two things, we've built a really robust local resource system. And so again, just makes more sense. We're not paying any more for this. It's helping 4Kids. We already can collect the data on it. It just makes more sense. And so that is called Resources 757. And we really encourage anybody who has the capacity to share that information to please do so. I'll kind of wrap up quickly so that we can, if there's any questions. But one of the other big things that we've been working on is an aligned kindergarten registration approach. So again, each of the 5 cities that we work with, each school division was doing something different. Parents were getting information from here or there. They might work in one city and hear one thing, and they live in another, or they go to church, they play in a different city. And so we have talked long and hard about how do we kind of align this and make it make more sense for families. And I can tell you, I left the kindergarten classroom 26 years ago, and this was something that we realized needed to be done then. And so we've been working with our partners, the 5 school divisions and other community partners, to align and get information together for kindergarten registration. So we have a website, readysetregisterhr.org, that we're driving everybody to. You click on the city, it takes you right to the school division. We've got posters and things that we're sharing with our medical personnel so that they're putting it in their offices. We've got yard signs. Catherine was great last week to deliver, I think it was rain. Well, it was raining that morning, but it was a busy day, I know. Delivered yard signs to all of the feeding sites so that parents, when they're coming in to do the feeding sites, can see this information and get children registered. We know across the region that in some of our cities, as many as 50% of children are registering for kindergarten between August 1st and after school starts. So again, something that we've put a lot of effort into and are continuing to work. We also just wanted to highlight that we have a policy and advocacy work group. In your handouts today, I shared with you the Hampton Roads Early Childhood Policy Agenda that was created through all of our input from all of our stakeholders, our steering committee, and in partnership with Smart Beginnings Virginia Peninsula. During General Assembly, we did a lot of work up at the state level, sharing information. We've done some work here locally, as well as sharing information with City Council and wherever information is needed. So we do focus on that. We've been really busy during the COVID crisis. The child care has really kind of become our main focus in supporting these businesses. There have been a lot of changes. The governor has made them reduce class sizes. There's a lot of concern. We've done things like supply delivery. We actually had EVMS medical students delivering supplies to child care providers, which was really cool. We kind of dubbed it as Heroes Helping Heroes. But we've also tried to connect child care providers with all those business supports out there with, how do you apply for the PPP loan? What small business loans are out there? We're working on some family child care connections as well. We know that many of our folks who are looking at child care are looking for family homes because they're smaller groups, and so we've been working on figuring out ways to connect and support them as well. So really a lot of kind of responsive changes in what we've been doing to make these things happen. So I guess, a lot of times people say, well, that's all great and fine, but what can we do to help? And I just really want to share with you that being a voice for early childhood is one of the best things that you can do. For cities and communities to really be a livable community, childcare is an essential part. One of the silver linings of this COVID crisis has been that I think we as a Commonwealth and as a nation have really figured out that childcare is a critical and essential part of our communities. And we are not going to get moms and dads back to work if they don't have access to childcare for their children. I think that probably in the next couple of weeks, as we figure out what exactly is happening with the schools, and whether or not they're opening, the impacts on child care centers and family day homes is going to be huge. They're going to have to change the way that they do business. They're going to have to figure out ways to support some of these remote learning things. So just really being a voice for early childhood. But I don't want it to simply focus on child care, because oftentimes we think about education as the only important piece of early childhood. But it's really not. It's about making sure that children are healthy and families have what they need, and that children are ready to learn. So, if you can be a voice and let people know about the critical need for high quality child care, that our child care system right now is really fragile due to COVID, and that early childhood investments build really strong foundations for life. Children who start school behind statistically are going to stay behind, may never catch up, and so these are really important things on putting a child on a lifelong trajectory. If anybody's interested in working in a working group, we're happy to have folks do that. And then last thing, if you can share information with your organization, if any of you are on Facebook, we have a Facebook page, and sometimes simply just getting people to like and share a post that we've made really helps to get information out. So that was a lot, but I'm happy to entertain questions. Also wanted to let you know our website is up there, minus9to5.org, and we have a lot of information specifically about the initiative and what we're working on. We have a really robust COVID-19 resources page. And then here's my email address if anybody's interested or has any questions later. But I'm happy to entertain any questions or thoughts or comments. Yep, sure.
I don't know if you're aware, Chesapeake Regional has a mobile monitoring bus, and many of my mind go to, would there be a need in the future? I think there would be a need in the ability in the future to have something similar. What struck me in the report was the lack that to be done like that, because a lot of times the problem is the people living in those underserved communities or underprivileged aren't going to take time off work and they'll get paid.
Right.
Like that. So bringing service to them, they can get those well-being visits and hearing vision checks. Is there a test, is it something like that?
Yeah, we would love to. Chesapeake Regional, I had 2 babies at Chesapeake a very long time ago, but I did have 2 babies there, and they used to have the mom's mobile that did kind of that initial visit. But yeah, I mean, we work with CHKD Pediatrics, to think about ways, and I mean that would be really wonderful if we could, as a community, figure out ways to make things like that happen. I think those are down the road, but those are exactly the kinds of things we really just want to remove barriers and make sure that everybody has access to what they need. It's not just if you can drive your car to the pediatrician, but you know, if you don't have transportation, or you can't get off of work, or you know, it's too much challenge to take 4 kids into the doctor's office. Those kinds of things. So great question.
Just a quick, in the book, I didn't get the.
Oh, sorry, I've got plenty.
I'll
Yeah.
get it later, but are statistics in there?
Yes, we have a lot of statistics. Yeah.
Do you have any initiatives with businesses to have childcare in
We actually, part of the conversation that we have had around the family child care is connecting with employers to think about, you know, do they want to contract, or how can we make something that helps connect? So we don't, on the south side, we don't really have as many connections. There aren't, like CHKD used to have a child development center on site. I know ODU still does, which is predominantly for employees. Obacy Hospital, Centera Obacy. So we would like to see some of that connection, but our focus right now is really on helping to connect the business leaders with information that they can share with their employees about finding childcare. So rather than, you know, specific, like, you know, this organization has their own center, but to say, here's a resource that you can call, here's where you find information about childcare, and that kind of thing, just because that's an easier step right now. But, you know, I think we are going to find that the child care system, because of, you know, people that are trying to work remotely, still need child care. You know, if you're trying to work and you've got a 3-year-old climbing all over your lap, it's a little hard. I've been on some pretty funny conference calls. The best one was with a little 3-year-old dancing literally on mom's desk. She kind of pushes him out of the way, and all up in the corner of the screen, all you can see is his little bum dancing back and forth, and she was dying of embarrassment, and I was just loving every minute of it because it was so cute. But, you know, folks need to work, and so that's going to be a problem. I think that, you know, what happens with the schools, and if the schools shut down, I think we're in for a little rough road here for the child care system.
Well, and it's not this is not even so I would think some businesses would be particularly manufacturing.
Yes. Funny, I have met with one of our big manufacturers in another city talking about their challenges even on snow days. So yeah, and that's through our leadership council that we're building. A lot of that is to talk about the connection. We've got Sean Avery from Hampton Roads Workforce Council, Brian Stevens from the Hampton Roads Chamber of Commerce, and some other big leaders to really help us kind of think about how we can support businesses. You know, childcare isn't just about the children. Childcare is about the economic drive of businesses wanting to come to the community. It's about creating a workforce that, you know, if we get children started on the right foot, in 18 years we're going to have a workforce that has the skills we need for our community to be able to hire people. So it's really a multifaceted issue. Other questions? All right, well, thank you so much for the opportunity to talk to you today. I appreciate that. I will just hop that down. And slide over here. Got my cords all twisted up here.
Thank you very much, Dr. Glasgow. We appreciate you being here today and filling us in with that information. Chuck mentioned we're going to try to get the raffle started up next week if possible. So anybody with birthdays or anniversaries in the month of July, please bring in something that we can raffle off.
Over the past 6 months.
Well, yeah, I mean, some people, I guess, from January through June have got off kind of easy, but if anybody wants to bring anything to raffle off, that'd be great. Other than that, if there is nothing else for the good of Rotary, we are adjourned.